My name is Jayadev Swain. I am second year medical student. So today I have been asked to examine your abdomen. So to confirm your name, may I know your name please?
Naveen.
And your age please?
27.
Okay, thank you Naveen. So today I will be examining your abdomen using stethoscope and palpating using my hand. Okay. So it will be okay for you?
No problem.
Okay, thank you. So I will ask some questions. So have you taken any food before coming?
No.
Okay, so do you feel any pain over your abdomen?
Not at all.
Okay, thank you. So Naveen, can you show me your abdomen?
Yes.
Okay, thank you. Can you do like this? Okay. Can you open your mouth? Can you lift your tongue over the? Okay. Thank you. For this examination, so you will be lie down on the table. During examination, if you feel uncomfortable, just let me know so that I can stop the examination. Okay. Make the patient comfortable in the supine position with a pillow under the head. Raise the gown to below the nipple line. Groin should be visible, but the genitalia should be remain covered. On the right side of the bed, inspect the surface counters movement of the abdomen. Location of umbilicals or any inflammation is there or not. Auscultation provides important information about the bowel motility. Place the diaphragm of stethoscope gently on the abdomen for bowel sounds or note their frequency and character in each quadrant. If the patient has hypertension, auscultate the epigastrium and each upper quadrant for bruits. In one of these areas that has both systolic and diastolic component strongly suggest renal artery stenosis. The cause of hypertension. Auscultate for bruits over the aorta, the iliac arteries, and the femoral arteries. Fluids with both systolic and diastolic components suggest turbulent blood flow from the atherosclerotic arterial disease. This helps you assess the amount and distribution of gas in the abdomen, viscera, and masses that are solid or fluid-filled, the size of liver and spleen. Abdomen lightly in all four quadrants to determine the distribution of tympani and dullness. Usually predominates because of the gas in the GI tract, but scattered areas of the dullness from fluid and feces are also common. Gentle palpation aids detection of abdominal tenderness, muscular resistance, and some superficial organs and muscles. Palpate the abdomen with a light, gentle dripping motion. As you move your hand to different quadrants, raise it off the skin, gliding smoothly. Palpate in all four quadrants. Deep palpation is usually required to delineate the liver, edge, kidneys, and abdominal masses. Using the palmar surface of the fingers, press down in all four quadrants. Okay, Naveen, can you take deep breath? The patient to breathe deeply. Touch wide open. Identify any message. Note their location, size, shape, consistency, tenderness, pulsation, any mobility with respiration or pressure from the examining hand. Your findings from palpation with their percussion notes. If you will find any inflammation of parietal peritoneum, ask patient to cough and identify whether the cough produces pain. Then palpate gently, starting with one finger, then with your hand to localize the area of pain. Ask the patient to flex their knees, which is helpful to palpate any tenderness or inflammation. Estimate of liver span by percussion. At a level well below the umbilicals in the right lower quadrant, percuss upward towards the layer. Identify lower border of the dullness in the midclavicular line. Next, identify the upper border of the liver dullness. Starting at a nipple line, percuss downward in the midclavicular line until the lung resonance shifts to liver dullness. The span of liver dullness is increased when the liver is enlarged. Measure in 2 centimeters the distance between your 2 points. Span of liver dullness. The liver span is greater than in men than in women. Measurements of the liver span by percussion are more accurate when the liver is enlarged with a palpable edge. Your left hand behind the patient, parallel to and supporting the right 11th, 12th ribs adjacent soft tissues below. Remind the patient to relax on your hand. By pressing your left hand upward, the patient's liver may be felt more easily by your examining hand. Right hand on the patient's right abdomen, lateral to the rectus muscle with your fingertips below the lower border of the liver dullness. Ask the patient to take a deep breath. Try to feel the liver edge as it slides down to meet your fingertips. Hooking technique may be helpful, especially when the patient is obese. Place both hands side by side on the right abdomen below the border of the liver dullness. In with your fingers and up towards the costal margin. The patient to take a deep breath. The liver edge is palpable with finger pads of both hands. If liver is non-palpable, place your left hand flat on the lower right rib cage and gently strike your hand with the ulnar surface of right fist. Ask the patient to compare the sensation with that produced by similar strike on the left side. Percussion of the spleen. There is two techniques which may help you to detect splenomegaly and enlarged spleen. The left lower anterior chest wall roughly from the border of the cardiac dullness at the sixth rib to the anterior axillary line and down to the costal margin. For a splenic percussion sign, asking the patient to take a deep breath, percuss the lowest interspace in the left anterior axillary line. This area is usually tympanic. The spleen size is normal. The percussion note usually remains tympanic. In palpation of spleen with your left hand, reach over and around the patient to support and press forward the lower left rib cage and adjacent soft tissue. With your right hand below the left costal margin, press in towards the spleen. Your hand is too close to the costal margin, you will not be able to reach up under the rib cage. Ask the patient to take a deep breath. Try to feel the tip or edge of the spleen as it comes down the middle fingertips. Repeat with the patient lying on the right side with leg flexed at the hips and knees. In this position, gravity may bring the spleen forward and to the right into the palpable location. The kidneys are retroperitoneal and usually not palpable. Palpate the left kidney on the left side of patient. Place your right hand behind the patient just below the 12th rib with your fingertips just reaching the costovertebral angle. Place your left hand gently in the lower upper quadrant, lateral and parallel to the rectus muscle. Ask patient to take a deep breath. Feel for mass. Right kidney may be palpable, especially when the patient is thin. The abdominal muscles are relaxed. To capture the right kidney, return to the patient's right side. Use your left hand to lift up the back and right hand to feel deep in the right upper quadrant. Proceed as before. The kidney may be slightly tender. The patient is usually aware of capture and release. A right kidney is more anterior and must be distinguished from the liver. The tenderness of the kidneys, ask patient to sit up. Place your left hand over the kidney area, the ball of one hand in the CVA area. Strike it with the ulnar surface of your fist. High aortic pulsation, press gently deep in the epigastrium slightly to the left of the midline. Raise the width of the aorta by pressing the deeply in the upper abdomen with one hand on each side. The aorta. Special techniques like assessing possible ascites, common complication of cirrhosis, for dullness outwards in several directions from the central area of tympani, map the border between tympani and dullness. What's umbilicus? From ascites, there are two additional techniques like test for shifting dullness, percuss the border of tympani and dullness with the patient supine, then ask the patient to roll onto one side, percuss and mark the borders again. For a fluid wave, by tapping one flank sharply with your fingertips, feel on the opposite flank for impulse transmitted through the fluid. Appendicitis is a common cause of acute abdominal pain. Yes, any signs of McBurney's point? Okay, after taking the examination, I found that there is normal in my abdomen. So, thank you for being cooperative.